Come on in. My name is Dr. Matt. I'm going to do your exam today. It's very nice that you're here. Wonderful. I'm going to get some information from you. I want to make sure that I have the right chart. Okay. Can you please verify your first and last name and your date of birth? Good. And do you have any allergies to any medications that you know of? Oh, okay. All right. Go ahead and tell me a little bit about what's going on. What brings you in today? What kind of symptoms you have? Okay. And how long ago did they start? Are they on and off, or they're constant? Okay. Do you take any medications? Is there anything that helps? Okay. Any other symptoms? Have you noticed any peripheral vision loss or blurry vision? Is that in both eyes or just right or left? Okay, and how long ago did that start? Okay. Are you experiencing any pain? On a scale of 0 to 10, how would you rate that? Okay. And how would you describe it? Is it sharp, dull? Okay. Are you taking any medications on a daily basis? Okay, do you remember the name of the medication? Oh, right, so it might be metoprolol. Do you know how many milligrams? Is it a white or a blue pill? Okay, so it might be 25 milligrams, and that's once a day, correct? Okay. Any surgeries in your lifetime? How long ago was that? Okay. Perfect. And have you had any injuries, especially to the head or the spine? Okay, so when you were little, do you remember how old you were? Okay, so you were about 12 years old. Okay. Were you hospitalized? Hospitalized for 3 days? Okay. And any other hospitalizations besides the one when you were 12 years old? Okay. is it okay if we do an exam now? All right, I'm going to start with your blood pressure. So we want to make sure that none of your symptoms are caused by hypertension. First, I'm going to put the pulse oximeter on your index finger. This measures your heart rate and your oxygenation. Alright, so just hold that there. Perfect. Okay, so go ahead and give me your arm. Perfect. I'm just going to get this a little bit higher. Perfect. Just gonna give you like a big squeeze. Make sure that your legs are uncrossed. And I'm going to take your temperature as well. This will go on your forehead. Go ahead and relax. Good. 98.0. Alright, and let's check your oxygenation. Is 99% on room air. Okay. Heart rate is a little bit elevated. Okay, 101. And your blood pressure is also a little bit elevated, 137/68. Okay, so let's go ahead and write all of this down, and then we'll start with the head to make sure that we are checking for any lumps or bumps. Okay, blood pressure was 137/68. We're going to keep an eye on it, make sure that it doesn't go any higher, and the heart rate was 101. Now I am a little bit concerned about the heart rate, but let's put some gloves on and we'll start the head examination. I'm going to first palpate your head. Is that okay? Alright, so I'm going to come a little bit closer. Any pain here? Just going to palpate your lymph nodes. So we're checking submental. Alright. I'm going to do a scalp check. I'm not seeing any lesions, so that looks very good. Alright, I'm gonna check your tongue and your mouth first. Go ahead and give me a big ah. Okay. Let's do that one more time. Ah. Alright, a lot better. So, uvulus, midline. I'm not seeing any swollen lymph nodes in the back of the throat. Now I'm going to check your tongue for symmetry. Can you go ahead and stick your tongue out? Good. And move it up and down. Right and left. Okay. Can you stick your tongue inside your cheek? And the other side up. Okay. Go ahead and give me a big smile. And frown. Buff your cheeks. Good. Go ahead and keep them buffed for me. I'm going to try to unbuff them. Don't let me do that. Okay. That is good muscle tone there, so I have no concerns. Let's go ahead and check your nose. Go ahead and look up for me. Okay. We're looking for any deviation of the septum. Okay, keep on looking up. A little bit of redness. Alright, I think I need a different instrument here. Okay, go ahead and look up. Have you noticed any kind of pain when you breathe? Okay, keep on looking up for me. Okay. I'm going to go ahead and cover one nostril. Go ahead and breathe in, breathe out. Okay. A little bit of obstruction there. Again, breathe in, breathe out. Good. On both sides, I'm noticing some obstruction. We're going to check your smell, your olfactory nerve. Go ahead and try to take a deep breath in. Can you identify the smell? Lavender. Good. Okay. We're going to go ahead and check your taste as well. Okay. Go ahead and open your mouth. 2 drops. What does that taste like? Sour. Okay. Very good. I think that looks normal as well. Let's go ahead and check your ears. Alright, I'm going to ask you to look that way for me. Okay. I'm not seeing any redness. Have you noticed any changes with your hearing? Okay, let's go ahead and switch sides. Okay. I didn't know that you were hearing some buzzing. Is that in both ears? Okay, so that seems like it's a sign of tinnitus. Let's go ahead and come back to center. Good. Okay, I'm going to check your hearing. I'm going to put the tuning fork behind your ear, and I'm gonna need you to tell me when you don't hear the sound anymore, okay? So that's behind the ear. Tell me when you don't hear it anymore. Good. Okay, what about now? Tell me when you don't hear it anymore. Okay, there was a little bit of delay there. Go ahead and tell me which position here is louder, position 1 or 2. Okay. And now, position 2 or 1. Okay. We're going to take a sample from your ears. I want to make sure that the liquid I saw is not cerebrospinal fluid. So go ahead and just relax for me. I'm going to collect a small sample from here. Any pain? Okay. And the other side. Okay. I'm gonna have the nurse put this under the microscope. Let's see what we're missing. Okay. I'm going to check your optic nerve now. Okay, so go ahead and look behind me, straight at the wall. I'm going to come very close to your eye. And we're looking for any swelling behind the retina. Just keep on looking behind me. I'm just going to touch you gently here on your head. Any pain? Okay. Good. And now let's switch eyes. So I'm going to have you look behind me at the wall. Okay, very good. So go ahead and try not to blink from me. Good. Okay. I think next time when you come in, I'm going to put some solution to dilate your pupil so that we can take a look better. But for now, I think that was normal. Okay. Now I'm going to check your facial sensation. So first, I think I would like to just touch your face on the left or the right. So go ahead and close your eyes. Good. And tell me if you feel this on the right or left. What about now? Okay. And now? Okay. And now? What about here? Okay, and here. Good. And here. Good. Any pain when I'm touching you? You're next to the forehead. Okay. We're going to check for any changes in temperature. Go ahead and keep your eyes closed for me and tell me if you feel this warm or cold. 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 What about now? And now? Warm. Cold. 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 Okay. Now go ahead and tell me if you feel this sharp or dull. First, I'm going to show you what dull is going to feel like. And this is what sharp is going to feel like. Okay, so go ahead and tell me if you feel this sharp or dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. What about now? Dull. 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 And now? Sharp. 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 Dull. It seems to me like there's some sensorial problem there. So we're going to do some more investigation to make sure that cranial nerve 5 is intact. And this is the one that usually innervates the mandible and jawline. Okay. I'm gonna have you cover one eye. Very good. And we're going to do a little bit of reading. I want to see if you have any vision loss. And can you please tell me what letter you see here? Okay. What about here? Alright. And can you read the last row? Okay. Go ahead and switch eyes for me. Can you tell me what color this is? Okay. And what color is this? Alright. What number do you see here? Okay. And here? Good. Can you tell me which circle is smaller? 5 or 6? Okay. Can you read the last row starting with the first letter to the right? Okay. Perfect. There's no vision loss there. Okay. I'm going to check your reflexes. Go ahead and relax your jaw for me. Good. 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 A little bit of diminished muscle tone on the right side. Okay. Let's take a look here. I'm going to have you lift your shoulders up, so shrug your shoulders for me. Okay, I'm going to try to push them down. Don't let me do that. Okay. Now I'm going to try to turn your head towards the right side. Don't let me do that, okay? Good. And I'll do the same thing on the other side. Don't let me do that. Okay. Go ahead and open your eyes as much as you can. Okay. Go ahead and look right here for me. Good. And now look here. Good. Can you please tell me which fingers are moving, right or left? Okay. Good. Okay. Good. Okay. Good. 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 Go ahead and tell me when you don't see my fingers in your field of vision. Now. Okay. Same thing. Tell me when you don't see them. Now. Okay? Tell me when you don't see them anymore. Now. Okay. Okay. I'm going to cover one eye for you. Go ahead and tell me when you see my fingers in your field of vision. Now. Good. Now. Good. Now. Now. Let's go ahead and switch eyes. Perfect. Okay. Now. 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 Alright, go ahead and tell me how many fingers you see up. Okay, what about now? Alright, and now. Okay, and now. Okay, what about now? Okay. How many fingers do you see up? Okay. Alright. Okay. Okay. What about now? Okay, and now. Okay. Alright. Okay. We're going to have to do a few more tests. Okay, let's listen to your lungs. Okay, go ahead and take a deep breath in for me. And exhale. And again, take a deep breath in for me. And exhale. Okay. I'm going to listen to your heart now so you can go ahead and breathe in normal. I can hear only S1 and S2. Now S3, now S4. I'm going to check for murmurs. Okay. Go ahead and take a deep breath in. And hold it for 1, 2, 3. Exhale. And we'll do that again. Take a deep breath in. And hold it for 1, 2, 3. Exhale. Good. I was able to hear a murmur, and I don't see that in your chart. Okay. We're going to go ahead and order some x-rays. Okay. And we'll do that right away. I'm going to have you go to the other room. That's where the x-ray machine is. And we're also going to draw some blood. Is that okay? Okay, perfect. Don't worry. We're just being very precautious about your diagnosis. I want to make sure that we're ruling out anything that might be a little bit more serious. And when we'll find out that it's not serious, we'll go ahead and probably prescribe some medication that will help to ease up your symptoms. Okay. Do you have any questions for me? Okay. Well, it was very nice to meet you. Let me go ahead and take my gloves off. And if you have any questions or concerns, don't hesitate to give us a call.